The first U.S. measles death in a decade now. An unvaccinated child has died now in Lubbock, Texas, amid that outbreak. More than 120 cases. And for a little context, all of last year, the U.S. had 285 cases of measles. Right now, Texas alone has reached almost half that number. But Health and Human Services Secretary Robert F. Kennedy Jr. yesterday actually downplaying those concerns.
Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
You heard how our new HHS secretary is downplaying this measles outbreak. Does that concern you?
You know, we're really focused here on taking care of our community and taking care of the patients and families who are impacted here in West Texas. So that's really where our focus is right now.
He is the Health and Human Services Secretary, and he's sort of downplaying, saying this is something that happens every year, but clearly it doesn't. The numbers are rising. Now there's a child that's dead. It's happening in Texas, New Mexico. It's working its way now around the country. That has to concern you.
Well, this measles outbreak, as you mentioned, is a very significant outbreak. And unfortunately, we've had, as you mentioned, one patient has died, and we've had a number of patients who've required hospitalization, as well as over 120 patients who've tested positive. That likely underestimates the total number of patients who've been impacted, as not everyone is tested. And, you know, beyond even those who've been directly impacted, I think having a measles outbreak in the community is concerning for all of our community members. People are being impacted in terms of potentially having to miss school if they've been exposed, having to miss work. The impacts of something like this are broad and ripple throughout the entire community. So we're absolutely concerned about what's going on here.
How much worse do you think this could become, Doctor?
That's a good question. I don't know that I have a great answer to that. I do think we're still early in this outbreak, looking at reports of other outbreaks that have happened at other times, perhaps 3 months, perhaps longer in terms